Okay, hi Jax, Dr. Buford. Just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen, and your shoulder has a lot of arthritis in it. You've lost most of the cartilage off the glenoid here. What we're looking at there is kind of raw bone. The little patch of cartilage that looks the right color is kind of right there. So there's not much cartilage left. You can see that the biceps tendon's been frayed and partially torn. And this is an obviously degenerative shoulder. We're going to do our best to get things together for you. Here's the rotator cuff, what there is of it, which is not much. So we're going to go ahead and take our shaver here and do a couple little things and show you some more in a minute. Okay, so we've debrided the inside of the joint as much as we can here. And now we're passing a wire through the biceps tendon. Here you go. And this is in preparation for doing what's called the biceps tenodesis. A lot of times the biceps can be a source of pain, and this is going to help take care of that. Sometimes you even have to use the biceps as part of the rotator cuff repair. We're going to pass that needle, spinal needle, one more time. Right there. There's another pass through right there. And now we'll pass the super shuttle through. Grasper. And now we're going to reach around behind the biceps to retrieve the relay on this side. We'll go ahead and load this and show you some more in a minute. Okay, now that we've got the bicep secured, we're going to release it here. Okay. And now we're going to change positions and have a look in the subacromial space and get to work fixing whatever we can with the rotator cuff. Okay, so we're up in the subacromial space, and this is obviously a big bad tear. We are looking from the lateral portal with our camera. That instrument you see there that helps remove some of the soft tissue so we can see, that's coming in from the back. So this is the back of your shoulder over here. And then there's another gray cannula right here that we're going to hold on to right there. That's coming in from the front of your shoulder, which is way up here. So right now we're just trying to get an overall image of what's going on here before we propose a way to fix as much as we can. Okay, so we're getting closer to being able to see the front. That's all the way down the front. We've got a lot of just incompetent tissue, as you see here. So we're going to have to remove that to see what's really rotator cuff and what's just scar tissue. We'll show you some more in just a minute. Okay, so here's what we're dealing with. The back of the shoulder is back here. And we can see underneath here, we can see the exposed bone. And we're going to try and release that infraspinatus and see if we can't repair down what we can. Grasper? Yeah, so if we can get this up a little bit, that might be beneficial to you. Down something like that. You can certainly try that. We'll start there. Hold down, long press. Spinal needle. Pause. So we're planning our first anchor just to stay way in the posterior aspect of the humeral head. We're going to place it right about here. Okay, we'll show you some more in just a minute, just to give you an idea of where we're at here. Okay, so we've got our first anchor in the bone. You can see it there. And now we're going to go ahead and reach in from the front of the shoulder and take some of these sutures out the front in preparation to tie these. Long press, pause it. Okay, so we've got two sutures tied posterior to hold down this posterior aspect of the cuff. You can see what we've tried to do here. We've still got one more suture coming from that part. We're going to go ahead and clean things up a little bit, and then I'm going to entertain the idea of placing a side-to-side suture next. So we'll show you some more in just a minute. I just want to show our initial progress at this point. Okay, so we've placed our first kind of ripstop or side-to-side suture. You can see it there. And the hole is a lot smaller than when we started. I think we can all agree on that. So we're going to place another side-to-side suture here in just a second. We still have another suture from the first anchor that we're not going to pass quite yet. And then we're going to ultimately place another suture anchor, I think. But we'll show you some more in just a minute. Okay, so we've got two sutures tied from the first anchor in the back. We've got two margin convergent sutures here. And now we've got that hole coming together better, a lot better actually. And now we're going to take the third suture from the first anchor and pass it basically somewhere back in here. We're still going to probably place some more margin convergent sutures, but I want to get this third suture passed so we don't run out of space. Okay, so we're making good progress. We've got that third suture tied. So the back of the cuff is pretty well secured. That's the infraspinatus part back here. We've got two side-to-sides. That looks pretty good. Trying to get some things out of our way so we can see. And then what we're left with is right here. I don't really want to take away any tissue. I don't have to. But I do need to be able to see. So we always work those two goals against each other. So we're going to go ahead and for sure place another anchor in. What I'm debating here is whether I can get another side-to-side in. We'll decide that in just a minute. I think we can. So let's get ready for another straight crescent suture. Okay, so I want to show you what we're doing here. We're going to place another anchor down. This is the biceps tendon, which we're going to incorporate into the repair to give us some extra collagen here. But for now, we're going to take a spinal needle, check our angle. That looks pretty good, and you can see we're going to maybe come a little bit more posterior. Yeah, you can see here we're going to be able to place our anchor pretty close to the articular margin, right about here. Pause. Okay, so let me show you what we're doing here. We've got three side-to-sides now. 1, 2, 3. We're using the biceps tendon to give us some extra strength in the repair. And so you can see we've already passed one stitch through it. We're about to pass that black and white through it also, as well as repair the remaining part of the cuff. So we'll keep working and show you some more in a minute. Pause.